Hello, my name's Andrew Schmidt.
Hi.
How's it going? I'm a student
Good.
physical therapist at the University of St. Augustine. What's your name?
Cool. I'm Pauline Swan.
Hey, Pauline Swan. How's it going?
Good.
Can I just verify that that is your real name? Yes? Okay, great. Can you also tell me what today's date is?
Today is January 26th,
Okay,
2019.
great, awesome. And where are you exactly?
I'm in the University of St. Augustine, Miami.
Oh, great, excellent. That is where we are. So what brings you in today? I see that you on my chart that you have a triceps strain. Is that correct?
Yeah.
Okay, and you're experiencing some pain and a little bit of swelling as
Yeah,
well?
it's just like a lot of pain, like right here in this
Okay.
area,
How'd that happen?
and just playing too much volleyball, I guess.
That'll do it. That'll do it. So I think I could help you out today. What we're gonna do is, I think your injury indicates some cryotherapy. Basically, what that is I'm going to apply a cold pack to the area for about 10 to 20 minutes. And that's going to help decrease some of the swelling by vasoconstricting all the surrounding vasculature, as well as increasing your pain threshold. So basically, in layman's terms, your pain's going to go down. It's going to be less angry,
Cool.
right?
Yeah.
So before we can do that, let me just visually inspect the area. Okay, great. There's no rashes, no open wounds or anything like that. And before we even begin, I need to first see if you have any sensation. Okay, so
Okay.
I'm going to do that by kind of conducting a sensory exam.
Sure.
Basically, what that involves is me kind of rubbing this very lightly over different areas of your skin, and you telling me if you could feel it. Okay.
Okay.
So we're going to start on your left. We're going to kind of use that as a baseline. So this is what it's going to feel like, and whenever you feel that, just say yes. Okay. So if you could close your eyes for me.
Yes.
Okay, great. And
Yes. Yes.
okay, awesome. And currently, on a scale of 1 to 10, with 1 being no pain at all, and 10 being like, oh my God, get me to an emergency room right now, where would you kind of rate your pain?
Like a 6.
A 6? Okay, so I'm going to ask you that again after the therapy's over, just to kind of see if there's any qualitative change. And do you have any history of like hypertension, any aversion to the cold? Do you have Raynaud's, which is like when you kind of have an allergic reaction to it? No? Okay, because those would all be some things that would kind of indicate to me that cryotherapy might not be the best for you. I might have to do something like a soft tissue massage or something like that
Okay.
to kind of decrease your pain. All right, so what I'm going to do is I'm just going to kind of elevate your arm. So, are you comfortable? Okay, great. All right, so what I have here is a cryopack. This is basically like a chemical kind of that retains cold very well. And I've kind of put a damp towel around it. It's going to help kind of conduct or kind of draw out a lot of the heat from your joint, okay?
Okay.
So I'm just going to leave it right there. And that's about the area, right?
Mm-hmm.
And when I palpate it, is there any sort of pain right now?
No.
No? Okay. All right, so I'm going to leave it there for about 10 to 20, even 30 minutes, depending on how you react to it. What I'm going to do is I'm going to leave you with this call bell. If at any time you start to feel uncomfortable, just give me a call, okay?
Okay.
One last thing, you also might feel some cold, which you're probably already feeling right now, but then you're going to feel some burning, some aching, and then some numbness, and that's really when the therapeutic effects are going to start. Okay, so do you have any questions? No?
No.
Okay, great. I'll be back in about 10 minutes just to kind of check up on you, see how you're doing, okay? Or 5 minutes, yeah. All right, Pauline, how's it going?
Good.
Okay, it's been about 5 minutes, so I'm just coming back to check up on you. Do you mind if I kind of visually inspect
Yeah,
the
sure.
area? Okay, great. Okay, great. There's no like aversive reactions to the cold. Do you have any questions or anything like that?
No.
Okay, I'm gonna come back in another 5 minutes. If you need anything, just remember to ring the call bell, okay? 5 minutes later. Okay, cool. Time's up. So what I'm going to do is I'm going to remove the hot pack, or the cold pack, excuse me. Great. Still no adverse reactions. Okay, so remember how earlier I had you rate your pain on a scale of 0 to 10, with 0 being no pain whatsoever and 10 being, oh my God, get me to an emergency room? Can you do that again for me?
0.
Okay, awesome. And I'm also going to conduct a sensory test as well. Once again, I'm going to start on the non-affected side. If you could close your eyes for me, just tell me when you feel me kind of brush that against you, okay?
Yeah. It's
Excellent. Okay. Okay, great. So it seems that you've lost some sensation temporarily. This is that's a side effect of cryotherapy. You're going to regain it. Don't worry. Okay, so now that you've started to feel some of the benefits of cryotherapy, we're going to progress through the rest of our regimen for the day. That's going to include me doing some light soft tissue work just to further decrease the swelling, which is going to hopefully increase some range of motion as well. And we might do some 50% 1 rep max exercises just to kind of further decrease the pain, as well as the swelling, before we progress onto actual progressive resistance exercises in our future sessions. Okay?
okay.
Awesome. Well, thanks so much. Let's get to work.